This is a single-payer statewide health system for all Illinoisans, the only solution for Illinois. My name is Nicholas Skala. I'm the former Senior Research Associate at Physicians for a National Health Program and co-founder of Healthcare for All Illinois. This first slide represents our rising healthcare costs as a proportion of gross domestic product. You can see the growing disparity between healthcare costs as a percentage of GDP in the US and Canada, but that's not why I'm showing you this slide right now. The point is that gross domestic product is a measure of all the goods and services that we produce as a society. It represents our total social output. And as healthcare costs grow, the problem affects all sectors of our society. It's a social problem. We see the effects of our nation's healthcare crisis not only in the rising numbers of uninsured, but also in terms of the economic cost to business and the restrictions placed on governments when funds had to be diverted from other needy areas. Indeed, the health crisis is a problem with tentacles that reach everywhere. It's a problem both for doctors and patients, for business and labor, for government and for private citizens. It should be obvious that such a comprehensive problem cannot be addressed with band-aids and half measures, yet we persist in convincing ourselves that real reform is impossible, or that maybe this time a band-aid will work. Since the early 1990s, Minnesota, Oregon, Maine, Florida, Utah, Washington, California, and Vermont have been among the states that have attempted to patch up their fundamentally flawed systems. All of them have failed. Massachusetts, using the same plan that Governor Blagojevich now proposes for Illinois, is failing for the second time. With the plan proposed by the majority of the Adequate Healthcare Task Force, Illinois is about to embark on the same path. The aim of this talk is to show you that there's a better way. Now, the way that we're most used to thinking about the healthcare crisis is in terms of the number of uninsured. There are currently 1.7 million uninsured Illinoisans, according to the U.S. Census Bureau. And data from the Institute of Medicine shows that 18 Illinoisans die every week due to a lack of health insurance. The most commonly proposed solutions to the healthcare situation involve finding ways to help the uninsured afford private health insurance policies. But simply providing private health insurance to them is not a solution. One reason is that having health insurance coverage is no longer synonymous with access to care. The enormous increase in healthcare costs has caused consistent deterioration in the quality of private insurance policies. Today's private policies are so laden with deductibles, co-payments, and other uncovered services that more than 1/4 of the insured find themselves going without needed care due to costs. And as health costs continue to explode, both employers and insurance companies have found that the only way to offer affordable premiums is to create new generations of stripped-down, near-worthless coverage. We can see this reflected in Illinois' epidemic of medical bankruptcies. Illness and medical bills now contribute to half of all U.S. bankruptcies. About 40,000 Illinoisans found themselves financially ruined in 2004. But perhaps more significantly, more than 3/4 of those 40,000 had insurance at the time they got sick. At the very least, even if it doesn't get you access to care, health insurance is supposed to protect you and your family from financial ruin in the event of medical emergency. Current policies don't even do that. And as citizens are victims of the vicious cycle of rising healthcare costs, so are businesses. Recent fair share campaigns by labor unions and other groups have focused, legitimately, on employers such as Walmart who provide low wages and skimpy benefits, effectively asking taxpayers to cover their workers. In fact, until recently, Walmart had a program which trained employees on how to apply for Medicaid benefits. But even employers who want to provide for their employees, including many small businesses, find themselves crushed under the weight of rising healthcare costs that are not their fault. Those who sustain benefits for their employees quickly find themselves at a competitive disadvantage. As a result, forcing employers to provide coverage to their employees only forces them to cut wages, other benefits, or jobs. Many simply drop coverage altogether. And as employers drop coverage, the numbers of uninsured rise and government is left to pick them up, costing us all more. One example of this is in the state children's health insurance program. There were 8 million uninsured children in the U.S. in 1985. In 1997, when S-CHIP was passed, 5 million kids got coverage through the program. But because of the deterioration of the health system, 5 million more became uninsured since then. This has made expansion of this public program a zero-sum game. Because the health systems continue to deteriorate, because we haven't solved its fundamental issues, we have the same number of uninsured kids now that we had in 1988. We're still paying for those 5 million that got coverage and would have to pay for that again to cover another 8 million. What does this mean? Lesson 1 is that simply expanding existing private insurance policies is not a solution. Current private insurance policies offer inadequate protection, and as we just saw, any gains in coverage will be quickly offset as costs rise and employers shed benefits. Lesson 2 is that any real solution to the healthcare crisis has to do two things. First, it has to offer coverage more comprehensive than that currently available on the private market. As we saw, current policies cause people to go without care that they need and cause them to go bankrupt when they get sick. And second, we have to control costs so that benefits are sustainable. So how do we explain this problem and start to solve it? We have a few places to start, beginning with the rest of the advanced world. Although we as Americans have a strong tendency towards exceptionalism, the United States is not the only nation in the world struggling with the problem of how to provide health care to all its residents. Looking at other industrialized nations, I want to highlight three things. The first is that of all the industrialized nations listed here, the United States is the only one that does not provide some form of national health insurance to all its citizens. The second is that although we're used to hearing that we have the best health system in the world, in reality the United States performs poorly in comparison with these other nations on major international health indicators. This data from the Organization for Economic Cooperation and Development shows the lower life expectancy in the United States. And this one shows our far higher rate of infant mortality. And we could go on and on like this through maternal mortality, hospital inpatient days per capita, etc. Two studies last year detailed how Brits and Canadians have lower rates of nearly every chronic disease. In fact, when the World Health Organization ranked national health systems based on overall performance, the U.S. ranked 37th, just behind Costa Rica. The third thing I want to highlight is that although these nations insure everyone and keep their populations healthier, they spend far less than we do. This slide illustrates health spending per capita in each of these nations in 2005. Why do we spend so much and get so little? The easiest way to begin answering this question is to ask yourself a question. If you were an insurance company CEO, who would you want to insure? This graph breaks down the U.S. population by health spending decile. The people who spend the most are on the right side of the graph, and the people who spend the least are on the left. As you can see, 20% of the population accounts for more than 80% of health spending. I'm going to tell you two things that probably aren't going to surprise you. The first is that private insurers are only interested in the people that cost little. The sick and the poor are already relegated to government programs. That 80% represents people who are in Medicare, the elderly, the disabled, and the sick and costly, and in Medicaid, our program for the poor. Private insurers compete for the healthy and the profitable. This chart helps us explain why we can spend so much more for so much less. Among the nations we just looked at, all of them have taken the fundamental step of rejecting the financing of care by for-profit insurance companies, except for the U.S. The natural market behavior of insurance companies is to compete to cover healthy, profitable people while shunning anyone who actually needs care. To do this, they erect massive bureaucracies with no other purpose than to fight claims, issue denials, and screen out the sick. They consume our care dollars, but their main output is paperwork headaches. In response, hospitals and doctors' offices must employ armies of administrators to deal with the separate payment bureaucracies of thousands of different insurance companies. U.S. businesses are saddled with the costly burden of administering their own health benefits. Co-payment collection and processing, eligibility determination, utilization reviews, sales, marketing. The scope of the bloat is staggering. This slide begins to give an idea of the explosion of administrative waste within our health system, comparing the growth of administrators to the growth of physicians between 1970 and 2005. In 2003, a team of Harvard researchers totaled it up and found that 1/3 of our health spending goes to administrative costs. It doesn't have to be this way, though. It's the natural outgrowth of a fragmented system that relies on profit-seeking insurance companies to finance healthcare. Eliminating private health insurance companies and streamlining health financing through a single public payer could recover enough currently wasted money to cover all the uninsured. The Harvard researchers estimated that the U.S. could save $350 billion with a single-payer system.